Hello students, today we are going to revise the topic dementia. So first let me give an introduction. What is dementia? So dementia is an organic disorder which interferes in thinking and social symptoms that interferes with our daily living, right? So dementia is a group of conditions characterized by impairment of the brain function such as memory loss and judgment. So dementia is a chronic organic disorder which interferes with the brain functions such as memory loss and judgment. Let's start with introduction. Dementia consists of variety of symptoms that suggest chronic dysfunction. Global impairment of intellect is the essential feature, manifested as difficulty with memory, attention, thinking, and comprehension. Other mental functions can also be affected, including mood, personality, judgment, and social behavior. Although specific diagnostic criteria are found for various dementias such as Alzheimer's disease or vascular dementia, all dementia have certain common elements that result in significant impairment in social or occupational functioning and cause a significant decline from a previous level of function. Approximately 50% of people with dementia have reversible illness if treatment is initiated before irreversible damage takes place. Now, let's see about epidemiology. Dementia occurs more commonly in the elderly people than the middle age. It increases with the age from 0.1% in those below 60% of age to 15 to 20% in those who are 80 years of age. With the aging population, the prevalence of dementia is rising. The prevalence of moderate to severe dementia in different population groups is approximately 5% in the general population older than 65% of age and 20 to 40 in the general population older than 85 years of age. 50 to 20% in outpatient general medical practices and 50% in chronic care facilities. So of all patients with dementia, 50 to 60% have the most common type of dementia, dementia of the Alzheimer's type. The second common type of dementia is vascular dementia, which is casually related to cerebrovascular diseases. So, what is cerebrovascular disease? So, cerebrovascular disease that refers to a group of conditions, disease or disorders that affect the blood vessels and blood supply to the brain, right? If blockage, malformation or hemorrhage prevents the brain cells from getting enough oxygen, brain damage can result, right? So this is cerebrovascular disease, and vascular dementia account for 15 to 30% of all dementia. Now we will be seeing what is classification according to ICD-10 criteria. So, under F00 to F09, organic, including symptomatic mental disorder. So, F00, dementia in Alzheimer's disease. F01, vascular dementia. F02, dementia in other diseases classified elsewhere. F03, unspecified dementia. F04, organic amnestic syndrome, not included by alcohol and other psychoactive substance. F05, delirium not induced by alcohol and other psychoactive substance. F0.6 is other mental disorder due to brain damage and dysfunction and to physical disease. S0.707 is personality and behavioral disorders due to brain disease, damage and dysfunction. S09 is unspecified organic or symptomatic mental disorder. Now let's see etiology. What are the causes for dementia? So significant loss of neurons and volume in brain region devoted to memory and higher mental functioning. It means those neurons are involved in memory and higher mental functioning that cause insignificant loss in dementia. So that is one of the cause. Environmental factors, infection can be there, metals and toxins. Excessive amount of metal ions such as zinc and copper in the brain. Early depression, common genetic factors seen in those with elderly depression and Alzheimer's disease. Now, first we will be seeing untreatable and irreversible cause of dementia, which cannot be reversible and untreatable. This causes degeneration disorders of central nervous system, Alzheimer's disease. This is the most common of all dementing illness. Then Pick disorder. So what is Pick disorder? Pick disease. Pick disease is a rare condition that causes progressive and irreversible dementia. This is also called frontal temporal dementia. It means it affects your frontal and temporal region, right? Next is Huntington's disease. Huntington's disease is also a rare disease. We can see inherited disease, the progressive breakdown of nerve cells. It affects a person's abilities that uses a moving key and disorder. Next one is Parkinson's disease. What is Parkinson's disease? It is a disorder of central nervous system that affects movement and often results in tremors. Hands will be shaking by the time. Next one we are going to see treatable and irreversible cause of dementia. So vascular multi-infarct dementia, intracranial space occupying lesions, metabolic disorders, hepatic failure and renal failure, endocrine disorder, myxedemia and Addison's disease. So what is myxedemia? Myxedemia is a kind of advanced hyperthyroidism. And Addison's disease. So Addison's disease is Addison's disease in that adrenal gland don't produce enough hormones. That is Addison's disease. Which hormone adrenal gland produce is cortisol and aldosterone sometimes. Infections, AIDS, meningitis and encephalitis. Intoxication, alcohol, heavy metals, anoxia, anemia, post-anesthesia and chronic respiratory failure. So in this case, disorders are treatable and we can reverse the symptoms of dementia by treating all the disorders. Now we will be seeing the stage of dementia in first stage, which is also called early stage, which stays 2 to 4 years. In second stage, middle age, we call, which stays 2 to 12 years. And in stage 3, which is called final stage, up to a year or more than that. So in stage 1, what happens? It's early stage. In stage 1, forgetfulness will be there in a person, declining interest in the environment, hesitancy in initiating action, and poor performance at work. In stage 2, progressive memory loss will be there, hesitates in response to questions, has difficulty in following simple instructions, and the mood will be always irritable and anxious. Wandering, neglect personal hygiene, and social isolation. In stage 3, we will be seeing a marked loss of weight because of inadequate intake of food, unable to communicate, and does not recognize family members because of forgetfulness. Incontinence of urine and feces, lost the ability to stand and walk, death caused by aspiration pneumonia. Now, we will be seeing types of dementia one by one. Cortical dementia. So, in cortical dementia, what happens? Cortical dementia happens because of problem in the cerebral cortex, right? Which is also called outer layer of brain, and that play a key role in memory and language. So, whenever people with this type of dementia usually have severe memory loss and can't remember words or understand language. So, this is in simple language we call cortical dementia. So, dementia where the brain damage primarily affects the brain's cortex or outer layer. Cortical dementia tend to cause problem with memory, language, thinking, and social behavior. Next, we will be seeing subcortical dementia. So, what is subcortical dementia? Is like a person will be slow in mental processing, person will be feeling forgetfulness, impaired cognition, apathy, and depression will be there in subcortical dementia. So, dementia that affects part of the brain below the cortex, subcortical dementia tends to cause change in emotions and emotions movement in addition to problem with memory. Next one is progressive dementia. Dementia that gets worse over time, gradually interfering with more and more cognitive abilities. What are the cognitive abilities? So, sustaining attention, response to inhibition, speed of formation, memory, recognition. So, that is cognitive skills, we say. Fourth one is primary dementia. So, in primary dementia, such as Alzheimer's disease, in which dementia itself is a major sign of some organic brain diseases not directly related to any organic illness. And secondary dementia. So, in secondary dementia, that occurs as a result of physical disease and or injury such as HIV disease or cerebral trauma. Now, we will be seeing the clinical feature of dementia. In that, forgetfulness will be there. Losses things, forget the numbers, right? Confusion with performing simple tasks. There will be poor concentration, confusion about month and season. They are not sure about particular thing, what they lost. They have very unclear thoughts. They will be always puzzled, confused. Problem in learning new skills and ideas, disorientation in time, place, and person. Aphasia is impairment in speech, amnesia, loss of sleep, and suspiciousness. Inappropriate sexual behavior will be there, unable to dress, groom, and toilet self. They will be always wandering, misplacing things, and changing personality. Now, let's see the management. What are the treatments available for dementia? Is medication used in treating the Alzheimer's disease are citrine hydrochloride, Cognax, and the second one is donepezil hydrochloride recept. Antipsychotic agents we use if there is any psychotic symptoms in patients. So, we use this drugs, risperidone, quetiapine, and olanzapine. And is there any convulsant? So we use anticonvulsants to control the seizures. Now, if patient is or a client is feeling depressed, so we use antidepressant agents and mood stabilizer to stabilize the mood. Low dose of selective serotonin reuptake inhibitors and other newer antidepressive agents should be considered. Now, nursing diagnosis. So, potential for injury related to disorientation as evidenced by muscular incoordination, potential for violence related to hallucination as evidenced by agitation. Third one is alteration, thought process related to vascular disease as evidenced by delusional or memory defect. Disturbance in self-concept related to loss of independent functioning evidenced by social isolation. What are the nursing interventions now? So we need to follow their daily routine. We need to take care of their nutrition, their body weight. We need to take care of their personal hygiene, toilet habit and incontinence, accidents that we need to prevent. Then fluid management. We need to monitor. Mood and emotions needs to be in control. Wandering, disturbed sleep that needs to be managed, and interpersonal relationship. So in conclusion, dementia is an acquired global impairment of intellect, memory and personality but without impairment of consciousness. Dementia occurs more commonly in the elderly than the middle-aged. It increases with the age from 0.1 in those below 60 years of age to 15 to 20 in those who are 80 years of age. So dementia consists of variety of symptoms that suggest chronic dysfunction. Global impairment of intellectual is the essential feature manifested as difficulty with memory, attention, thinking and comprehension. So this was all about dementia. Today we have seen introduction, then epidemiology we have seen, then classification we have seen according to ICD-10, then etiology we have discussed. Then we have seen treatable and reversible cause of dementia and untreatable and irreversible cause of dementia. Then we have seen the stage of dementia. Then we have seen the types of dementia we have discussed. Then we have seen the clinical features of dementia. Then we have discussed treatment of dementia, which includes medications. Then we have discussed nursing diagnosis and interventions for that. Thank you.